Let's learn about it today. The installation and operation of this picosecond machine. After we receive the machine needs to be assembled. Then the place for assembly. It just has a foot switch, bracket and handle. First, let's carry out the hanging rack here. Installation of the hanger. We got this. Here we can just tighten it. Then install the stand for the handle. The handle bracket has 2 screws. This screw is used for fixation. If you go here, fix it in the current installation direction. It can be fixed with a cross-head screwdriver. Then assemble the handle. We can see the interface of the handle. Here it has a black rubber stopper. When we insert this handle, this rubber stopper needs to be removed. The rubber stoppers can be kept well. Then when we connect to the host part, insert these 2 sockets. Align with the following 2 interfaces. Then let's plug in here for a demonstration. After plugging in, this side of the snap will lock automatically. Let's take another look at the back of the machine. The first one is the water filling hole. It is necessary to connect our logo. Before using the machine, we need to add water to the machine. Add distilled water or purified water. Let's pay attention. When adding water, the cover of the overflow hole should be opened. Later, when we add water to it, pay attention to whether the water from the overflow hole is flowing out. If it is like the current situation, on our way of adding water, water is coming out here, then we can stop adding water. At this time, our water tank has been filled up. We only need to cover this overflow hole now. Tighten it slightly. Then add water to this side of the hole. Let's take the logo off here, because the water addition has been completed. Then wipe the remaining water stains on it clean. Let's keep these 3 rubber stoppers well. Then let's take a look at this part of the instrument. It is connected to the foot switch. The following is for plugging in the power cord. First, connect the foot switch here. We have completed the installation of all the instruments now. Then this tube, we can hang it on this hanger. After that, power on the instrument and it can be used. Next, let's get to know this machine, the use of this probe and other accessories. One is the power cord connected to the machine. Then the goggles are worn by the operator. The MSK is worn by clinical patients. Its main function is to be used for avoid the damage caused by lasers to the eyes. When using machines for clinical practice, goggles need to be worn. Then here we can see there are 6 heads in total. Each of these 6 heads has a logo. This logo, we can see it above this head. We are currently holding a head of Q in our hands. We can do it through a symbol above the head to distinguish each head, its function. So now let's talk about it. The purpose corresponding to each head. First up is our black red 1064到532 probe. It is mainly aimed at removing black and blue eyebrows. Titles also have another use for removing spots. It belongs to an invasive blast head. Then beside us, there is also a 532 and probe. It also applies. Remove some pigmentation spots and the like. For example, brown, coffee-colored or red spots. It can be operated with 532. These two heads all belong to invasive probes. Meanwhile, the tattoo on this head needs to be removed. For example, tattoos with colors. We can also use our 532小时 is carry out removal. Then we have now finished talking about the invasive 106and 532. Let's take a look at the non-invasive one again. Non-invasive 532 and 1064. As the name suggests, it refers to these two heads of ours. It is for us to get tattoos. There are still spots on the eyebrows. When conducting clinical operations, it causes less damage to the skin, so we collectively call it non-invasive. 功能上 it is the same as our invasive probe, but in energy, it will cause less damage to the skin. Then let's take a look again. The black-faced doll head below, corresponding to our wavelength, is 1320 mn. It is specifically used for whitening the skin, shrink pores, control oil, kill bacteria and rejuvenate the skin. There is also the anti-pornography campaign. Eliminate pornography. It refers to the aspect of brightening our skin tone, such as dark complexion and so on. It is such an operation. The now 755小时 is the shape it actually strikes out. It is in the shape of a beehive. The other probes produce a dot. Let's make a distinction like this. The honeycomb head corresponds to G5mn. It targets a scattered patch, chloasma, station nevus. It also helps to remove yellowish complexion, rejuvenate the skin and shrink pores. The skin of the beehive all has certain functions. Okay, now we can make a good distinction. The functions and operations of all the heads. When we are using different functions, we need to install the probe accordingly. For example, we are going to carry out a tattoo removal next. This way, it is recommended to operate with the 1064 invasive probe. Of course, if the customer said thinks invasive substances cause relatively high damage to the skin, we can choose non-invasive 1064 for tattoo removal. Then next, we conduct an installation demonstration on the probe. When installing the handle of the probe, we should pay attention to aligning it. Then it is fixed by rotation. Pay attention to the situation of leg when rotating. It can no longer continue to rotate. We took it off, realigned it and installed it. After installation, we start from the force of rotation. Come and feel if it has been installed properly. It can be felt through rotation. Our probe has been fully connected. At this time, you can exert any more force. Rotate our probe. This led to the probe being tightened too much to be removed. Before we use the machine, listen to the handle every time you turn it on. Put the handle to your ear. Listen to see if there is any water on our handle. We can do it through the sound of the flowing water inside the handle. To distinguish, is there free water in the machine water tank? If the handle does not hear the sound of flowing water, at this time, we need to turn off the machine again. Then start the repeated operation again. Make sure this water flow reaches the handle. Only then can a clinical operation be carried out. Only then can one operate the machine. Otherwise, if the water doesn't reach the handle, it will cause the handle to burn again. This possibility is very high, so customers must pay attention. Next, let's move on to an explanation on the interface. After we press the power on button, click the screen to enter its function selection interface. The first one is to return to the local interface. The second one, it is the operation interface corresponding to our 1064 probe for 1064. The hair of the 755 probe and the 532 probe. Let's take a look at the click of one of them first. Enter our three operation interfaces. It's all like what we have seen. All the operation keys are the same. Let's take the interface of 1064 as an example. Let me tell you all about the operations on the interface. What we can see now is sensitive in the upper left corner. It refers to the current controller of ours. The total number of shots it used was sensitive. This total number of times, it will accumulate even when the device is turned off. It will just keep accumulating. Even if the device is turned off, it won't reset to 0. Then this interface corresponds to a wavelength of 1064. Then there is NG below. It refers to our current machine. Its energy set setting. Then set the hertz and the speed. Then this is the size of the spot. The size of the spots on our desktop. It is fixed, so we don't need to adjust the size of this spot. We just need to fix it at 10 mn. After that, we set the parameters. The button in the upper right corner needs to be clicked. Make preparations. After entering the preparation stage, we also need to cooperate with the full switch. Make animation on the laser. Next, let's have a brief review. A basic knowledge about picosecond laser clinical practice. First of all, we are up there. This picosecond machine has already been mentioned. It's an operation on the pigment. It is for the usage on each head. First of all, it is heart disease, patients with hypertension, pregnant women and some patients with mania, high diabetes, photosensitive, people who work under strong light for a long time, or sunburned skin, short-term skin peeling, or take antioxidants, or customers of other hormone-based drugs. None of these are recommended by us. Laser machine operation. Then comes the tattooing process. On operation precautions. For instance, a tattoo is one that has been applied for less than a year. It is not recommended to wash. The effect will not be ideal. If you can tolerate tattoo removal, don't apply anesthetic. Anesthetic has been applied. It is prone to hyperplasia in the later stage. It's normal to have a burning sensation after washing. You can apply some repair cream or S4 ventral use. Before washing, 75% alcohol should be used. Disinfect the skin. Because there is a stratum corneum and dirt on the skin. After washing, it is easy to cause infection on the wound. It takes about 2 days or a week to remove the tattoo. It will scab over. Try not to touch water before the scab forms. Scabs must fall off naturally. Don't pick it with your hands. Tattoo removal can only be done once at the tattooed area. Do not repeat. For example, the pattern we are seeing now, we don't have patients with tattoos here. So let's take a figure here. Explain it to the customer. For example, this is the tattoo we got on our bodies. Then when we remove it, just operate along its texture. After completing the operation once, no more operations can be carried out. If the operation is performed too many times in the same place, it is easy to cause the wound to heal very slowly. The recovery in the later stage was also not ideal. After having the tattoo removed, anti-inflammatory drugs can be taken for 2 to 3 days. Apply a little repair cream or something similar externally. Assist in skin metabolism. Have some fruit. Twice. The interval between tattoo removal should be close, about half a month to a month. On operator during the treatment. When using a laser gun, try to form a 90-degree right angle at the treatment site. Perform the operation. Let me show you how to use it here. It is a 90-degree angle perpendicular to the skin. Then one can see a radium released by a laser. A matte outlines. At this moment, let's step on the feet again. Then the operation can be carried out. Let's demonstrate it here. This is it. A general technique for tattooing. We guarantee that it emits light vertically. Reduce energy loss. If it is inclined, it may lead to a weakening of energy. We require every tattoo removal. All of them need to reach a phenomenon of bleeding. Because of this kind of tattoo removal, he has to break open the skin to wash it off. The pigment tattooed under the skin. He will have bleeding from the skin. This situation, the customer can be informed in advance. Let him avoid panic. Then the determining factor of the difficulty of pigment removal. Let's learn about it. There are many kinds of tattoo pigments. For example, plant pigments, compound pigment. There are also some chemical pigment removals. It is because of its pigment. Determine the difficulty of its removal. Like chemical pigments. If it is used for eyebrow tattooing, use it to remove this difficulty. It's the kind of pigment that is more common than the ordinary one. For example, plant pigments would be much more difficult. It doesn't matter whether it is shallow or deep, it is still quite difficult for it to remove this. If it is like plant pigments, it is very simple and quick to remove. Then this is about our recovery after the operation. After finishing, on our bodies, there will be some inflammatory responses in the tissues, redness, swelling, bleeding point. All of this is normal. Itching will occur later. This feeling of the tissue hardening, it is generally 7 to 10 days after the treatment. All the discomforts, generally, it will disappear by itself. This is only for some patients. Because of some customers' metabolism, it will be a little slower. It might take longer. It is prohibited to have your eyebrows painted during the post-operative recovery period. After washing your eyebrows, you can apply them again. Do not wash with water or exposed to direct sunlight. These behaviors are all very dangerous. It has an impact on the wound, including eating some spicy food. Drinking alcohol is not recommended at all. Some customers will ask, is on our part, what ointment should be applied after the operation to help with healing? It is suggested here that some can be applied, medical red mold ointment, or other wiping. Some other repair fluids are used for repair. Postoperative precautions. First, regarding redness and swelling, we also mentioned it above. It will disappear by itself at a certain time. During the healing period, some can be applied. This is repair ointment and some anti-inflammatory drugs. Avoid infection in our parts, then avoid direct sunlight and ultraviolet radiation. After scabbing, on that part, for normal skin, there is a distinction of pigments. The difference lies in normal skin. Not quite the same. This is normal. This will be fixed gradually in the later stage. Then comes about eyebrow tattooing. An operation on these cases. The number of treatments is generally around 8 to 10 times. For example, eyebrow tattooing on lip lines or embroidery lines. This is usually done about 8 to 10 times. Tattoos can be removed about 8 to 10 times. The intervals are all around 30 to 60 days. If it is an operation on the tension mold, in this kind of operation, we will need 3 to 7 times. An operation should be carried out approximately every 45 to 90 days. When operating, it is also in accordance with the method just demonstrated. In the infrared at all parts, then when making the call, the head must not stop at one part. The operation should be carried out along the entire area. Let's demonstrate it again here. If this part is what we need to remove, a tension mold. So when we are operating, through infrared alignment, step on the foot pedal to remove it. Move when removing. One can stay in the same place. The area we have fought can be fought again. It is carried out through such a method. Cloasma is treated with E2 operations lasting 15 to 30 days. Hit this area. The best effect is achieved when there is bleeding. The operation on acne is also performed 3 to 7 times. 45 to 90 days. The effect of the operation on acne is relatively less obvious. It is recommended to use dot matrix laser operation for freckles and age spots. Perform the operation 2 times. 15 to 30 days. It is also necessary to achieve when there is bleeding in the area. This is the best effect. Even tattoos are operated in the same way. It is also necessary to hit the affected area. Bleeding occurs. This is the most effective one. All of what we have mentioned above, all are routine operations. A piece of advice that is used quite frequently. Then let's talk about the operation again. When getting eyebrow tattooing or eyeliner, we need to pay attention to one point. Align and then move by paddling. Wash our eyebrows. Then at this time, the eyes, it is very close to this eyebrow area. Laser is very harmful to the eyes. We should avoid this problem. So it is essential to have the patients wear our eye masks. Cover the eyeballs. After covering the eyes here, step on the foot again to wash your eyebrows. At this time, after we wash off our eyebrows, it will leave some, the marks of being beaten. Then, when washing eyeliner, be sure to pay attention, because the eyeliner is the closest to the eyeball. At this time, we can use some. For example, cotton gauze, cooperate with the eye mask, cover our eyeballs, then proceed with the fight. This area of the eyeliner, we can through. Align this point of infrared, then strike vertically. When playing in a small area like this, the frequency must be slowed down a little. At this time, we need to set the frequency speed on the interface. The operation of a general novice, it is recommended here that the frequency be below 3. If the machine has been used, it can be operated at frequencies of 5, 6, or 7. We don't have a recommended value in terms of energy here, so we need the client's side. within the range he can bear, combine with it to achieve a bleeding effect, to regulate the magnitude of energy, then set a lower frequency here. Then we'll play here. That's fine. For other operations, we can click cancel, then click back. For instance, if we want to operate adaptation molar, some other spots have been removed. You can use the VAS on all 53275, pore whitening and shrinking. This tissue interface can also be used in this aspect. Carry out the operation. What we need to do next? Just replace this probe. Just replace it with the corresponding wavelength head. So that's all for our introduction today.